Okay, so continuing on with kind of looking at the effects of the electrical current on the tissue and the nerve, we kind of ended with that on the previous slide. Here we see the concept of capacitance. So in the last slide, we looked at the strength duration curves for the different tissue and what that means as far as the amplitude or the actual intensity of the current and the phase duration. Here we're looking at the concept of capacitance again. So capacitance is just the ability of a nerve to store an electrical charge. So if we're looking here, we have two different charges and we have the capacitance of the nerve here. Okay, so pulse A lacks the charge to overcome the capacitance of the nerve. However, as you see, B does. So B has both the combination of amplitude and duration in order to have an effect on the nerve. So what that does is once you overcome the capacitance of the nerve, then you're able to cause depolarization and you're able to then have an effect on that particular nerve. So again, this gets back to when you're selecting your parameters and your settings, that's going to be very important so that you can actually affect the tissues the right way. All right, characteristics of electrical current. So there's two concepts related to the adjustment of amplitude and duration. There's what's called the Rio base. This is the minimum amplitude needed to depolarize a nerve current when the phase duration is infinite. So you really only have this involved with a pure DC current or direct current, okay, where the phase the phase duration is continuous because it's just a constant direct current. The chronaxy is the time or phase duration required to depolarize a nerve fiber when the peak current is twice the Rio base, okay? So essentially what these concepts both apply to is both of them kind of affect the comfort level when you're applying transcutaneous electrical nerve stimulation. So that's essentially where these two concepts will play a role as far as how the actual stim will feel to the individual. So looking at the characteristics of electrical current, so one of the important parameters involved with electrical stim is frequency. Now you have to understand when you're talking about frequency, there's two types of frequencies. There's carrier frequency and there's beat frequency. Beat frequency will be something that you'll always be able to change and modulate. Carrier frequency is usually a function of the actual generator or the unit itself. Now, and it's also impacted by the waveform. Now, sometimes you can change carrier frequencies. The more important thing to remember is when you're setting your parameters for beat frequency. So frequency is the number of pulses generated per second. So it's in either pulses per second or it also uses the unit of hertz. Okay, so very similar to what you get. It's just like frequency with ultrasound. You're just talking about it with stim. So what frequency is going to impact is the number of action potentials that are stimulated. Okay, so although the same number of fibers are recruited, when you look at a higher frequency, that causes them to fire at a much more rapid pace, which then could ultimately increase the tension generated. And again, you also still have the impact of intensity on this as well. So the frequencies we're talking about here are carrier frequencies. So low frequency is anything 1,000 hertz and below. Medium frequency, which gets used with Russian stimulation, is between 100 or between 1,000 and 100,000. And then high, what would be considered high, would be greater than 100,000. So those are your carrier frequencies. Some things to kind of look at. Again, we talk about the physiologic effect depending upon how you manipulate your frequency characteristics. You can get what's called Wadensky inhibition, and that's when you get anesthesia between the electrodes, or you can work towards getting a tetanic muscle contraction where you get that nice strong contraction of the muscle. We'll kind of talk about how we make those modifications based upon your treatment goals, because obviously, when you're looking just at those two examples, they're two distinct treatment goals. And again, so electrical frequency and duration is commonly modified for specific purposes. So we're going to be going over again the frequencies and stuff that you could change in order to create different effects from the electrical stim. So briefly getting into the clinical application, because we're going to have a whole talk on this. This kind of gives some insight into the actual, clinical application, kind of going beyond just kind of the science behind electricity. Essentially, the reason why we will be using, so just to kind of give a quick summary, just so you can understand, the reason why we're going to use electrical currents are usually for one of three reasons. We're either looking to get some type of chemical effect, where we're looking to possibly drive an ion through the body, in the case of iontophoresis, where you're driving a medication through the skin in order to have some type of effect, either anti-inflammatory effect or pain-relieving effect. That's one, and you need a special stimulator. You need an iontophoresis stimulator in order to do that. Or you get one of two kinetic effects from stim. You either get a sensory effect, which again can be used for pain relief, or you can get a motor effect, or where you're either getting a twitch or a tetanic contraction. So a twitch contraction is kind of when the muscle's fluttering, or you get the nice strong tetanic contraction. What that's going to be based upon are your frequencies. Now, while we have all of these different waveforms of stim to use, okay, meaning we have, interferential, we have classic biphasic tens, we have high volt. They're all the different type of clinical waveforms. While there's a lot of waveforms and it seems like a lot, the frequencies that you pick based on your goals are going to be all the same. So in a sense, that makes it a little bit easier when you're trying to kind of understand all of this, okay? For instance, if you're trying to get a tetanic contraction to work on strengthening a muscle, you're trying to use stim as an adjunct to strengthening, and you're looking to get a tetanic contraction, whether you use Russian stimulation or you use high volt, or even biphasic tens, the parameters you set are going to be the same on all of them to get a tetanic muscle contraction. It doesn't change because you're changing the waveform. Now, if you're sitting there saying, well, why would you pick one waveform over another? We'll talk about that and clinically how you make that decision. Some of it is preference. Some of it is guided by, how comfortable it is for the patient, what have you. Some waveforms are more comfortable than others for certain things, okay? So for a motor tens, okay, you're going to pick between 2 and 10 hertz, so a very low frequency. Okay, tens can cover both high and low frequencies. You will get what's called a neurohormonal response. Okay, we'll talk about what that is later on. Sensory tens, where you're picking between 60 and 120, so this is primarily for sensory effects. You get that encephalinergic and gating effect, so your level 1 pain control would be done with this, with the 60 to 120. Neuromuscular stimulation for passive exercise. So this would be for your, getting that tetanic contraction of the muscle between 35 and 50 hertz, or 30 to 30, or 35 to 50 pulses per second. That would be for the strengthening. And then if you want to increase blood flow or lymphatic drainage, you would lower the pulse rate, 10 pulses per second or less, and get that, again, more of a twitch contraction, okay? So these are some of the basic settings. And again, even if you're not using, basic biphasic tens, which is one of your waveforms, you can still utilize your other waveforms with these frequencies to still get the same effect. So again, looking at the motor effects of stim, so if we kind of look at this chart here, you kind of see what we mean by as you gradually start to increase the frequency, you get more of a tetanic contraction, okay? So usually you will hit that tetanic contraction between 35 and 50 pulses per second as you're setting your beat frequency. So essentially, if you're below 35, if we're just using 35 as a marker, you're basically going to get a little twitch contraction. That's kind of what they're showing here. They're showing kind of everything below that. You're just kind of getting the muscle to twitch a little bit. Once you kind of hit 35 to 50, you're going to start to get that kind of nice, good technic contraction with the muscle, and then at that point, then you're turning up your intensity until then you would gradually get a stronger and stronger effect. So some other characteristics of electrical current: the rate of rise of the leading edge of the pulse. Okay, so this is a parameter that's, again, this is incorporated into the waveform, but it also affects the type of nerve targeted. Okay, so the rate of rise refers to the time it takes to get from 0 to max amplitude. Okay, again, a fast rate of rise is necessary, particularly when you have low capacitance tissue such as large motor nerves, in order to get stimulated. Okay, because sometimes low capacitance membrane can't store as much charge, and they accommodate quick. Okay, so you need to kind of avoid, because if they accommodate, then they're not going to basically get the same sensation. So accommodation can happen with stim, and this kind of helps to avoid that. So, and you could actually see that particularly in sensory nerves. So sensory nerves that carry light touch have a very low capacitance, and they could accommodate. Okay, so think about if you ever lost your sunglasses and it's because you had them on top of your head for a long period of time. That's the reason why. Your nerves accommodate it. You don't really sense it anymore. Well, the same type of thing can happen when you're dealing with stim. So this, again, is an inherent thing within the waveform. This isn't something that you change. Again, part of the key with a lot of this is, go through these concepts and understand what you manipulate and what you don't manipulate based upon the waveform. So when we're looking at whether or not a physiologic response within the tissues is going to happen with stim, there's 3 things involved, and they're involved with the law of Du Bois-Reymond. Okay, there are 3 factors. The 3 factors are: 1, the amplitude or the intensity has to be able to reach a threshold, so you have to have the intensity high enough. The current onset has to be fast enough to avoid accommodation, and that's where the rate of rise of the leading edge of pulse is involved. And then 2, the duration has to be long enough to exceed capacitance. Okay, so amplitude, intensity, you could modify. Phase duration, with some forms of stim, you could modify as well. You can make phase durations longer and shorter. The rate of rise of the leading edge of the pulse you can't change. Okay, and that's going to be different from something that we'll call ramp, which I'll talk about on the next slide. So ramping is when there's a programmed increase in the amplitude over several pulses. That's something you could change. So that's when there's actually a gradual increase in the intensity. So when you have a duty cycle, which we're going to talk about next, you can actually put what's called a ramp. That and the rise of leading edge of pulse are not the same things. Okay, you can adjust ramp. This is something that's inherent. The rate of rise of leading edge is something inherent within the actual waveform itself. So when we look at duty cycle, again, there's things you can modify and things that are based upon the waveform. So within the duty cycle, there's something called the extrinsic duty cycle. That's the on and off time. So if you want to set an on and off time for the stim that you are using, that's an extrinsic duty cycle. You can do that. There's also an intrinsic duty cycle, which is based upon the waveform that you're using, and that's when you get pulses basically kind of packaged into small clusters in order to get a specific effect on the tissue. So that's an important thing to kind of be able to look at when you're making your waveform selection. So for instance, if you select a 1 to 5 duty cycle, that would be the extrinsic duty cycle. So you do this many times, particularly when you're using electrical stim as an adjunct to strengthening. When you're trying to get a strong muscle contraction in the tissue, you want to do a duty cycle because you want to have an on and off time. Okay, so that's something that you can select, and in this case, giving the example of a 1 to 5 duty cycle, which you elicit a strong contraction and then get a rest period, and that assists with, again, as an adjunct to strengthening when the person's kind of limited with what they can do with the muscle. So this is what I was talking about with ramp. So ramp is different from the rate of rise of the leading edge of the pulse. Ramp is, again, something that you could set. Again, using that muscle contraction, or to say we're using Russian stim as a strengthening modality, You can set a ramp. So instead of on the on time, it just going right up to the intensity that you want to pick, you could pick what's called a ramp time. That tends to be a little more comfortable for the patient. The thing you have to keep in mind is that if there's going to be a ramp, that they're only going to be kind of at the intensity you want them at for a certain period of time. Okay, so we'll talk about setting ramp. It's usually good to do that because it's a little more comfortable for the patient instead of it just turning on and then going right up to the intensity. It's kind of a nice gradual lead up to the intensity and a more gradual contraction. So this is going back to the rate of rise. So here we have an abrupt rate of rise, and again, the idea here is to prevent accommodation. So what this does is it minimizes the chance of exciting high capacitance fibers and just limits the waveform's ability to kind of create that accommodating effect. So if it has an accommodating effect, then you're not going to get as much out of the overall treatment. So, and then here's an example of a slow rate of rise. So you see this kind of sawtooth waveform is what they call it. So what this does is it's a long rate of rise. It causes less stimulation of the high accommodation fibers while stimulating high capacitance fibers. So to kind of compare this to the previous slide and talk about it again. So the waveforms that have that immediate onset or a fast rate of rise that you saw on the previous slide, that's used when the goal of the stimulation is to excite sensory nerve fibers. So when we want to excite sensory nerve fibers, we don't really want accommodation, because if the person accommodates to it, they're not going to get the effect. Say you're trying to get a sensory effect for pain relief. If someone accommodates to it too easily, they're just not going to feel it anymore. Okay, it's almost going to not seem not perceivable to them. In the case of this, now this is kind of typically you will use only something like this when you're basically trying to stimulate a muscle membrane directly. So this you would use in what's called denervated tissue, where there's basically no nerve input into the muscle, because the reason why is you want to have a long phase duration, because that's the only way you're going to be able to kind of stimulate the denervated muscle. Okay, so this type of waveform you actually will very seldomly use. Not going to say you would never use it, but with the typical active population, this is usually not as much of a common treatment to utilize. So this is when you kind of completely lose motor nerve innervation, but you still have some sensory. So because if you don't have the slow rate of rise, it could actually get pretty uncomfortable for the patient. So here we look at a concept. So this is kind of what you would call a time modulated alternating current. So this is that, again, kind of showing you the difference between an extrinsic versus an intrinsic duty cycle. So this is the more showing you the intrinsic duty cycle, where you get little bursts that are created. So each burst has a carrier frequency basically determined by the machine. Sometimes machines do let you select a different carrier frequency, and we'll talk about kind of how to deal with that and what that means for your treatment. The patient doesn't feel this though, so this isn't like the on-off time that they'll perceive. But what this does is it allows for a little bit of a deeper penetration and an overall greater current application to the patient. Okay, so you see this type of effect happening with your medium frequency currents, your interferential waveform, or we also call IFC, and in your Russian waveform is where you see this effect. Again, this is something that you won't necessarily be able to change a whole lot. Again, this involves the carrier frequency. This is different from the extrinsic duty cycle, or what we call the on-off time, where the actual unit actually shuts off and doesn't put any stim into the body and then turns back on again. So when we look at electrode considerations, we're going to look at, again, we want to minimize resistance. We don't want as much, we want very little air to skin interface. So these are some important considerations when you're selecting your electrodes. Difference between single and multi-use. So most of your electrodes, pretty much for the most part, people utilize the electrodes that already have kind of the inherent backing on them. Again, technically they should only be used for one patient just to kind of minimize, obviously, contact between patients. There are also multi-use pads that you can utilize. There's carbon electrodes, which you can clean. You want to look at making sure you adjust the intensity after the electrodes are secured. So, put your electrodes on, make sure they're on there good, and then adjust the intensity. If you're having trouble getting the electrodes on the person, don't turn the intensity up and then try to adjust the electrodes, because all of a sudden, if you start to get greater contact, the intensity will become uncomfortable for the patient. So determine electrode size and location. A lot of time, larger electrodes tend to be more comfortable for the patient. Again, sometimes the body part region will kind of dictate to you whether or not you should use small or large, but I would use the biggest electrodes possible for an area, just to kind of keep it more comfortable. There's less current density under them. However, if you are trying to be a little bit more specific and targeted, or you're dealing with a smaller area, that will make you pick smaller electrodes too. The other thing too is how you space them apart will also dictate how deep the current goes, okay? So the closer you put them together, the more superficial the current will be. The farther apart, the deeper the current will go. So you'll have a little bit more of a superficial effect if you put the electrodes close to one another, put them farther apart. It'll make the current go a little deeper. Again, I talked a little bit about the size of the electrodes already and the current density. So larger tend to be more comfortable. Patients do tend to tolerate them a little bit more. And you have to consider too, if you're going to do monopolar treatments where you utilize a dispersive pad. So there are some treatments where, and some waveforms, if you're trying to utilize the charge of the current, you will use what's called an active and a dispersive pad. You'll actually use two different size pads. You have to make sure that you correctly place those active and dispersive leads on the patient. So again, the monopolar, you'll have an active and a dispersive pad. So you'll have a smaller active pad and then a larger, what we call dispersive pad. So you have to make sure that you have the poles correct, because if you're doing monopolar, you're trying to use the positive or negative charge specifically to create an effect. So examples of that would be in iontophoresis, when you're trying to drive a medication through the skin, and in wound healing, if you're trying to use the body's natural electrical charge to create a healing effect. For bipolar, you're just going to use equal size electrodes. An example of that is with, again, biphasic tens. You will use equal size electrodes. It doesn't matter where the positive and negative leads go to. Quadrupolar, you'll use a medium frequency generator for. In that case, you see quadrupolar with IFC. You're actually going to use 4 pads, and there's a specific setup for the 4 pads. You have to make sure that the 2 channels cross each other to create an effect with IFC, and we'll talk about that more in the clinical application. So again, just in summary, to kind of go back and look at some of the stuff, again, large diameter nerves have a low capacitance, so they cannot store a charge and they have a quick action potential. And this is the reason why, even when you're setting up for motor stim, you'll get a sensory effect first. So even when you're setting someone up for Russian stim, as you're turning the intensity up, they will feel the electrical stim, or they'll start to get the little pins and needles sensation prior to actually getting the muscle contraction. So that's why that happens. So sensory nerves always get elicited before motor, even at those kind of lower frequencies. And then the law of Du Bois-Reymond, intensity has to be greater than the tissue threshold. This is just what we talked about before. We have to make sure the phase duration is long enough. So, if you can adjust phase duration depending upon the tissues you want to affect, you have to make sure you can overcome the capacitance. And you need a fast rate of rise to prevent accommodation. So if you want to limit the accommodation, that rate of rise of leading edge has to be fast and abrupt. So again, with your learning outcomes, kind of understanding, again, your basic definitions of these concepts involving electrical currents, and again, just some of the science behind it. And as we get into the clinical application talk, again, you'll see more about the waveforms, and again, talk about, again, make sure you understand what are things that you can change and what are things involved with the actual waveforms themselves. That tends to make STIM a little bit easier to understand, given all of the various waveforms and things like that that we will actually be talking about.